Okay. Today I will be talking about three things. One will be the epidemiology. Second thing, what are the 12 tasks which participants are supposed to do while we are studying? And third thing, somebody has done a very good thing. He has developed a database on heat stroke. So we'll be talking about that how to analyze the data which is there in the Excel. So so let me start about the today's task. Basically, 12 things which students are supposed to do. That we'll be talking first. Then we'll talk about epidemiology, and then the demonstration how we can use the uh, epidemiology analysis by AP Info software. So, before I start with this, is there any quick question which you would like to ask based on the first two sessions? Anyone? Okay. So, there are 12 tips or 12 tasks which you can do on voluntary basis. First thing is make a group of 10 to 20% in your area, for example, students or college students or let's say staff working in the voluntary organization who would like to learn about epidemiology, statistics, etc. Second thing that the distribution of country, state, district. Means suppose this is for the teacher. If you are teaching 150 medical students in your batch, then you can allocate them in a group of five. Country, few people will be talking on France, other person will be talking on Pakistan or India like that, or across the state, Madhya Pradesh versus Bihar versus UP, etc. And then compare their various statistical parameters, why it is like that. Or suppose if you are from Gujarat, you can compare the Dahod and the Ahmedabad and the Baroda for purpose of some statistical data or parameters, etc. So that you will give you a lot of insight and the dialogue and discussion will be very fruitful and you can collect the best of all the areas. And when we talk about the ecological correlation, that means is a gross data. You have a temperature, rainfall, you have a meteor mortality, morbidity, etc. over a period of years, or say at the same year but at different places. And that gross parameters we have, then if we call it as an ecological correlation, is there not a comparison of individual person, but it's a comparison of the areas or population, etc. For example, the coastal area will have more filariasis compared to the other areas. And that may be explained based on the humidity, temperature, etc. Other thing is, I hope that all of you can distribute among yourself. For example, someone will look at the AB Hill stats textbook of statistics. Other person may look at the Taylor and Noveldon for the epidemiology or McMahon and Park for epidemiology, etc. And from that, you give very few chapters from that, even in the not the whole chapters, but few pages from that you can collect and then prepare. The fourth thing is one ebook you can prepare. Then there's a compilation of the ideas and how we can talk to the students, how they can be involved in various research studies. Uh, Given in a single class, if you have 150 students, give them a 5 minutes, and you will see that within 5 or 7 minutes, each of them may come up with few more ideas, and that may be compiled to the Google quiz or etc. Someone is speaking. Any problem?
ఈ ఐటమ్స్ రెగ్యులర్ గా ఉంటాయి.
Naveen, do you have some problem? So be attentive. At least don't keep your mic open. If you want to keep your mic open, I have a space for you. You want to communicate anything? Okay. The sixth thing is exploring further areas of advanced statistics. We are talking a simple and basic statistic, etc. But then, even they go beyond the p-values and they make question the p-value itself also. Because p-value instead of the single value, you may go the range of the p-value rather than the simple the p-value itself. So that way, multicentric research study or multivariate analysis can be taken further. And predictive analysis have a lot of value nowadays. Then, if you want to do some research, etc., then naturally, on a large scale, you require funding. So for that, CSR funds could be available, government scheme could be available, or some voluntary organization, particularly in the Gujarat and Maharashtra, there are a lot of voluntary organization where they have a lot of data available of the last 20 years, 30 years data available. And that data requires analysis. And that work can be taken off by some of you. And if you have some ideas or innovations, then government is providing startup funds, for example, seed fund or her startup for the females, or BIREC gives a funding like that. And at the end, evaluation of the course should not be only at the end, but after each chapter or each session, you can write in a group whatever criticism you would like to take. And then whatever our purpose, epidemiology research, etc. But if you want to measure our status, current status, and what we want to achieve ultimately. So my question to the group is that if you have only single individual, can you study that individual in statistical analysis can be done based on the observation of single individual? Is that sample size sufficient? That is the question to your group, and you can answer sometime in the our group itself. The question I repeat: if there is a single individual and your observation related to single individual, can you apply any statistical test on the observation on single individual? That is the question. Other thing is, if you want to go for the One Health, this only medical students or only Ayurvedic students are not sufficient. You need to have a collaboration with these engineering students, the art students, commerce students, environment students, business students, etc. And then together, if you make a team of 30, 40 students of various branches, then probably you can do the research on One Health. There will be students from statistics, computer department also, and that will be very, very useful to work on the One Health. And if you want to add any other points that you're free to add. So we'll be now going for the basic understanding of epidemiology. And while we talk about epidemiology, you should have at least one or two subjects in mind whereby you can relate this word epidemiology. And initially, when we were talking about epidemiology, we were talking about diseases, particularly infectious disease. But now we talk about the non-communicable disease also and health-related problems also. And not only problem health-related events, we can do it. For example, few people are having perspiration at this season. Few people are not having perspiration. So, what is the morbidity profile between the two groups, having a perspiration and not having perspiration? That is also possible. Then comes the in the public health practice. Without epidemiology, we cannot go further. And when we the word itself is so confusing, epidemiology looks very difficult, but it's very, very simple and very interesting. And some of you might have heard the stories of Sherlock Holmes, which is very interesting how this can occur. And when you explain how this can occur, when you prove it, then it's a very satisfying phenomenon. And for the purpose of understanding, if you use this science, then it will be very interesting. Few people say that Ayurvedic science is not scientific. Few people say the homeopathic is just a placebo and it is not scientific. When we go according to our modern medicine, uh, they may not be able to answer certain questions. But then we need to understand from their point of view also. There is also a science. When we analyze the medicines of homeopathy, we need to categorize the patient as per the homeopathic definition. But then people say that which path is good for a particular patient. In that case, then we need to analyze by independent method and which will be based on the symptoms of the patients, then science of the patients, investigation of the patient, as per the modern medicine, as per the Ayurveda, as per the homeopathy. And then a big database is to be prepared, and then we can analyze the data also satisfying all the sciences. Now, in this case, whenever we want to study something, we need to describe time, place, and person in detail, and then we can do the further data analysis. So, when we describe, it is a descriptive epidemiology. At what time, on which day. For example, today, if you say, what are the events taking place in the world? There is a war between the Russia and the Ukraine, then there's war between Gaza and Israel, and there's a sudden change, or not a sudden, but there's change in the leadership at a various states level, at the country level. Soon the election is over, and then so forth. Then there is a NEET exam is almost the on the verge of rather postponed to be accepted. So many confusions among the students. So many things can occur at a single point of time, and those events may or may not be related to each other, but we can consider what is happening right now. And then comes the place, where the place is governed by which government, like political leadership is which the party, or the place is concerned with the high altitude or low altitude or near the sea or higher than the sea level, etc. So time, place, then the person. Personal characteristic are too many. The hereditary disease could also be there, or person with old age, or gender things may be there, or a particular person is following particular religion, etc. So time, place, and person, when you describe the thing, is a descriptive epidemiology, and then when you further analyze, cross-tabulate the things, and try to see the association between the variables, then we call it as a analytical epidemiology. The word epi means upon, demos means people, and logy means science. It's basically a science of population, and we are using for the purpose of health. In the usually initial days, the epidemiology was concerned with the direct population. And if there is epidemic is there, we go there and find out, do the survey, and we find out what are the sources of outbreak, etc. But now, as the epidemiology, as the science grows, we are using the word clinical epidemiology. So, based on few cases also, we become alert. And consistently, the clinical epidemiologists and the classical epidemiologists, they should work together. Suppose one case of cholera comes to the hospital, or one case of unusual symptoms of respiratory system comes in a hospital, you find out from which area they are coming and alert the public healthcare system. Then if you work in such a close coordination, then it will be much better. Actually speaking, if there is a referral linkages between the clinical epidemiology and primary healthcare network, then the whole cycle of epidemiology will be over, and we can do the follow-up with the patient also. Clinician alone cannot uh, the talk about epidemiology, because They do not know what happens to the patient after you give the treatment to the patient. So the field work, public health workers, as well as the clinician, if they work together, then a lot of research can happen. Suppose a tuberculosis patient, why do they give up medicine in between? Or who are the patient with they are not coming back to the hospitals? Who are the patient who get cured within no time? So such things can be done if there is a constant feedback, constant interaction between the clinician and the primary health workers. And that is one of the good area for the research. Now, where do we apply this epidemiology? In this case, heat stroke, you have come up with one study. So what are the risk factors? Who are the people who are likely to have more heat stroke? So we can identify the risk factors. We can also try to identify the cause of the diseases. If you are using a various treatment options, for example, you are giving antibiotics for the prevention of the infection, or you are taking the universal precaution to prevent the infection, that there are different strategy which you can evaluate. And I said the natural history of disease for that, e- even without treatment and with treatment, both you can compare what happens to the people of suffering from a particular disease. Then the again estimating individual's risk of a specific health problem. What are the risk factor? What we say that risk factors as well as individual. What is the risk assessment of particular population? How is they are likely to have a particular disease? If you are doing for the sickle cell anemia, the tribals are more likely to have sickle cell anemia. Then the complete the clinical picture of disease for healthcare practitioners. Because usually what happens that when healthcare practitioner patients are coming on second or third day of the fever, and initial few days they might have taken home remedies or maybe taken a treatment from the chemist off like that, and then some of them may not go to the clinician at all. So if there is a particular epidemic, what happens to each category? I will tell you the story of the tuberculosis. When we went to the field work, that what happens to the tuberculosis patient who are giving up treatment in between. Not that all patients had a relapse. Few patients got cured of their own, even if they had given up the tuberculosis treatment. So why this happens? And how you can explain this? So this you can do provided there is a detailed epidemiological study. And in case of there is epidemic, then you can use this science for the purpose of epidemiological investigation. And in your particular case, whether it's a heat stroke or whether it's a PCOD or there is a case of depression, you take any current the epidemics, maybe NCD or the infectious disease, we can uh, go ahead as per the local situation. So before you start any uh, experimental study, you need to have observational research in which you are not intervening, doing anything. You can observe the patient, you can observe the people, you can observe their habits, the whether which kind of medicine they are taking, etc. And suppose we want to compare across the various pathies. In that case, you just observe what happens to the Ayurvedic hospital, what happens in the homeopathy hospital, what happens in the allopathy hospital, and make a list of the patients, what they are getting, what they are improving or not, etc. This will be the observational research in which, accept few parameters, rest of the parameters may be common, and then you can compare. I will give example. There are, let's say, thousand skin diseases patient coming to Ayurveda, coming to homeopathy, and coming to allopathy. What happens to them? Whether they get cured or they are not getting cured. What is the percent of people they got
Then
cured? How
छोटे
many
छोटे
cases
तीन वो
worsen?
चार फोटो
How
है ना,
many continue the treatment
चार
like this?
इमेज भेज दी, एज इट इज उतार लेना, ऊपर लिख लेना थोड़ा थोड़ा।
Uh, anyone, please switch off the mic. If you want to hold me, then you can specifically ask the question. Once your observational is over, then in this case, in experimental research starts. And experimental research is not necessary that you have to, the word manipulated or variables are measured. Measurement is true, but always there could be natural experimental also. It's not that human has to do it, right? So instead of only observing here, some kind of intervention we are doing it, and that intervention we are then whether it is effective or not, or whether it is detrimental or not, whether it is because of or in spite of what kind of results that we are comparing. In descriptive studies, as I told you, there is a time, place, and person. You go into detail and then find out how many people are affected, which kind of the caste is affected, which kind of religious, or which kind of the officers, grade 1 to 3, or socioeconomic condition, etc. You are describing. Sometimes you are going for the detail of the case studies also. It's not that you are going to study 1,000 people, but even 10 case studies, case series also you can take up. When these typical cases are coming up, at that time you need to do that. And in analytical studies, naturally we are going for either case control study or the cohort study in which you try to relate to variables or many variables, why this a particular outcome is there. Now, this is a one slide in which you have either descriptive study. In descriptive study, you can have a cross-section study. That means that you take, let's say, 5,000 population or 200 school children like that. Or you can also have the qualitative time, place, and person, as I told you. But epidemiology, usually, while we are talking over here, is classical epidemiology. Otherwise, in clinical epidemiology, you can have even 5 cases or 10 cases. You can use the non-parametric test to compare even a small sample also. In analytical side, you have observational study in which you have a cohort study, you have a cross-section study, and you have a case control study. You see the cross-section study this side also, that side also. On descriptive cross-section study, you have only time, place, and person. While in analytical cross-section study, you are going to compare. It's not that before and after. At the same time, you want to study. The students who are having a spectacles and students how much time they are spending for the mobile. If you are doing this study in 1,000 students, for example, it is a cross-section study. While in cohort study, you have usually two cohort with you. One cohort, let's say, having a vegetarian diet, another cohort taking non-vegetarian diet. Or you can have a two cohort, one cohort, let's say they are having organic food, other cohort having mixed food, organic plus other food, like that. And then follow up for a particular disease. So you start with the groups and then follow for the outcome of the disease. That's the cause study. While in case control study, as it mentioned, you start with the case. Case could be of hypertension, maybe of diabetes, or baldness, or skin disease, or any kind of case which you are defining and not having that case. Usually, when we say the case control study, people have something in mind. The case is having a case, a particular disease, and control means no disease. Agreed. But no disease instead of that, not that disease. You can have a patient of malaria, the patient of fever, but other than malaria, like typhoid or hepatitis, like that, and no fever. That kind of multi control can also be taken if other case control study. Is not only that case and control. There could be multiple controls in terms of numbers, in terms of times for the case control study. And if you take that, it will be more the effective in finding out the reason compared to the only one case and one control. And case and control study number need not be the same. There could be different numbers. Case can be 400 and the control could be 4,000. This is possible. Now, in a qualitative study, the time, place, and person, we develop the hypothesis, and the quantitative study or the analytical study, or for that matter, if we have experimental study, that is still better for the testing the hypothesis. And in this, the word how much, how it can happen, why it happens, that we are looking at the quantitative analysis. And that's why when you have so many variables, we'll see that in our history also, you should be constructing the matrix. In matrix, there is a variable to be compared with the variable. I will show in one Excel file. For example, there is a history file available over here. If you want to do the analysis of this, the study, then simply you do one thing. You take these variables on one side, and take the other thing, and then this is important. You transpose the same thing over here. Once you transpose it, this is what is to be done if you want to do the scientific analysis of any research study. And then you look at the number of variables, three, there are 12 variables. So now I will ask you a question. There are 12 variables. How many tables are possible theoretically? Can anyone tell me? There are 12 variables. And how many tables are possible? So one of the answer would be 12 into 12, 144. But that is not the answer, because this, when you say you have this kind of table, so 12 into 12, theoretically it seems 144. But the answer is this gender. You are not going to compare gender with the gender. So this is only a frequency. This is a frequency, right? So this 12 will be minus. They are not the cross tabulation. So 12 into 12 is 144. 144 minus 12 will be minus. And this, if you compare age versus gender, and this gender versus age will be the same. It's a mirror image. So this data is a duplication. So automatically, when you try to think that I want to cover the cover, so gender I want to cover along with the age, gender with the incomplete or comorbidity, etc., etc. Then you comorbid with various, then MODs with various, all this thing, it will be a duplication. And that's why the answer is, when you have a n number of variables, answer is, in this case, 12 into 12, that is 144. And the 144 to be minus 144 minus 12, because 12 will be the frequency. So now this comes to a 132. And because it's a mirror image, you divide by 2. So 132 by 2 is a mirror image. So 66 is the answer. 66, the hypothetical tables which you can have, you can analyze in AP Info or any other software like SPSS, and then find out which one is more significant. Try to use this. This is known as variable matrix. You should use it whenever there is a dissertation or a research subject. Then out of the 66, whatever are significant, that you try to do the try to reflect on that, further dissect on it, go for multicentric analysis or multivariate analysis, and find out exactly which are the important parameters. So this is how dissertation work or research work can be done. So I will uh, stop this. Any question on this? So I expect from you also that if you do some research study, you prepare variable matrix and then find out which one you should be using. So when you go for a variable, which tables you should be using at that time, you should try to use this method. Then how to determine what type of study is required? When I say that you take some topic, at that time, you should be asking your question, asking you yourself that which is the current problem, which problem is affecting maximum number of people, which problem has a solution, which problem you an individual or as a group will be able to address, whether the fund is available or not, whether the time available to you is there sufficient to solve that problem. All these things you should be asking the question, and then you should find out the study. And both the thing, qualitative and quantity, if the mixed study you are going to take, that will give you both the dimension, the depth as well as the width. This already we have considered, but the randomization word that we'll be using later on. Right? This quantitative study design or analytical research, what we say that now here the comes the word research. When you are using the epidemiology, you are using a particular study design, which kind of epidemiology you are going to use it, then we use the word research. In the research, you have a word which you are using is study design, whether it's the qualitative or quantitative, which kind of the randomization, what kind of randomization you will be taking, how much sample size you will be taking. Basically, when your epidemiological knowledge and biostatistical knowledge you apply together to solve some problem, to do some kind of the innovation, etc. And then you are going to use collectively for the purpose of research. Now, whenever you are doing some research study, the first thing would be you need to write down the purpose of the study or introduction, and then you go for the aim and objectives. The review of literature is important because if somebody has done it, you need not do it again unless you are going to find out some new uh, parameters or new risk factors or new treatment, etc. And the relationship between different phenomenon or between different variables when you want to compare various groups, this kind of study will be very useful. We need to, when we say the comparison, etc., the variable word is very important. Variable, something which varies, right? And it is to be measured or to be observed. And then only you can decide about the individuals, whether it's the age or whether it's the place, time, etc. You have something in your hand, and this measurements, which you are considering or you are describing something at that time, there is something like the word population. Each observation within the your study, each observe within the study observation should be in terms of variables. And when we use the population, the word population is very important in case of statistics. Word population means collection of each individual observations is the population. While in case of epidemiology, we say that collection of individuals is the population. So the word population in statistics and epidemiology differ. Now the word two words, dependent variable and independent variable. Dependent variable usually means person cured, not cured, worsened, died, etc. Dependent variable. Independent variable, what kind of treatment, what was the age of that individuals, what was the lifestyle of that individual, etc. But the word, the variables, dependent or independent, will be defined by your study itself. In your study, for example, waking up early in the morning is a lifestyle, but that may be your point of intervention, right? And based on that intervention, you want to improve the health of the individual. That is the outcome. So, dependent variable or independent variable that will be based on your study design. And these two kinds of things, when you want to compare, when I say the variable matrix for the purpose of data analysis, when I show you the Excel table, sometimes it so happens that you are thinking that this is the independent variable and not related with this. It will not have effect on the particular variable, but then it may have, and that you will be able to find out when you do the variable matrix and try to do the analysis. And this is how you can find out confounding variable. You might not have thought of that this could work as a confounding variable, but then it could be when a variable affects, right, the outcome variable, and you might not have thought about it, right? So such confounding variable could be there. As I gave you example on that day, that glycosylated hemoglobin was increasing because of age. Urinary creatinine was also increasing because of age, and that person has not considered this. I will give again another example. People say that COVID-19 had affected rich people more than the poor people. That could be something, the exposure to the infection. If rich people could have that exposure infection, they may also get protected. So the exact word rich and poor may not be important, but the environment in which they are staying, that may be a compounding variable. Now we'll end with this slide and then we'll go for the few question answer, and you try to do your research study in such a way so that you have the qualitative data also, uh, like the gender or smoker, non-smoker, or maybe the white or black, or maybe a different kind of gender, class 1, class 2 officer, like that. That is a nominal data among the qualitative. And then maybe ordinal data, mild, moderate, severe categories based on that could be the qualitative, quantitative data like hemoglobin, mild, moderate, severe. There could be the ordinal data can also be there. The order has some kind of meaning like mild, moderate, severe. While in this continuous data, quantitative data, usually we go for the ratio scale like height, weight, etc. That is more the widely used. And in our learning, usually I use the words the data from where you can find out the proportion and data from where you can find out the mean. And then there is a means command over here and there is a table command over here for the proportion. Here means command where you can find out the mean. If you go for the simple the terminology, then the analysis will be very easy. I stop this presentation uh, and I would like to show this matrix. This kind of matrix you should be using, right? And the data which was given to me, from each data, you should try to find out that this is from you can find out mean. This is from you can find out. Say, for example, before you start analyzing, you should know that this data gender, which command you going to use? Tables command. For age, which command you are going to use? Means command. For this is income, higher, lower. Actually, this, if it is taken in terms of per capita income, if it is actually the quantitative data, but because it is higher, lower, and middle, it is we are considered as the proportion and we'll be applying table. But in your research study, try to avoid this kind of category. As far as possible, go for the actual data. And then in future, you can do the categorization. But this categorization cannot be done reversely. We can find out now based on this, what is the income. So you should avoid this kind of variable and should take actual the relevant data in terms of measurement. You should not try to the convert into the group as far as possible. Comorbid condition. Here you will be using table command. And here multi-organ failure is there or not. Here you is going to use table command. Medication, yes or no. Table command. Here, water intake is a measurement variables where you can find means of water intake. Clothing, again, table command. And the temperature, you can go for means command also. And then sodium means this is what is this is a total leukocyte count. I don't know what is TSC. It may be total leukocyte count. This is how you should define which you have. Now we'll uh, try to do how we analyze that. Now these XLS file are much higher version, and sometimes you need to save them as a lower version. For example, in this case, XLS. And then you could change for the analysis purpose. Analysis. Save. Now you can see that this is a file. Analysis purpose is saved somewhere. Just a minute. Save as and lower version XLS for analysis purpose. This is final. And this is in the desktop. This file now can be used for the analysis purpose. So here what we'll do, we'll be starting AP Info 7. You use the classic. I hope all of you are here. You can interrupt me. Any question so far? So yeah, you read the file. If you read the file, you need to define which kind of file. So XLS file, browse, again browse, and analysis. Here, your data is in sheet 1. Select like this. This is how you can select. I have kept another file over here in which I repeat the process. I give the name test, sheet 1. I have kept the date. This is how you select your the file. Then next would be frequency. Okay. So you have done the frequency, and then you go for the tables command. Now in this file which you have given me, you have not taken the data of patients who are not having histo. That would have been better. So for time being, we'll compare few things: gender versus multi-organ failure or not. And because the data is very small, it is not interesting to the analyst because hardly you will find anything from this. But we are doing it for the sake of learning how we can generate 2 by 2 table. This data will not be a significant. So there is nothing to be found out from this. And if you want to use command means of age versus multi-organ development failure, in this, the age, if you can see, if there is a multi-organ failures, the age is more, 76, and the mean age is 74 years. If there is a multi-organ failure, if there is no failure, mean age is 46 years. This is how you can compare the things, and then if you have a large data, then when we can go for the statistical analysis. Right? Although it is very significant, that's why it is P is less than 0.05. Now we keep forum open if you have any question. Any questions so far? Uh, everyone need to ask at least one question, I think. Then only I can say that today's teaching is over. Come up with few questions. I will be sharing this PPT. So 12 tasks which are given to you, that is at least you can do some of the tasks if you would like to do. Naveen, you had given a very good effort. You can share your Google form with the other people. You should try to take a control who are not having the disease. Then our study will be much uh, better. You can share this in the group so that people can give data, 3, 4, or 5 data. Is that okay? Yes, we need to do separately the means and then the tables command, etc. And not only that, we need to do the standardization also. That I'm not giving you right now, but there are advanced commands where you can do the standardization because see, only 2 by 2 variable analysis is simple and it's only for the purpose of to start the analysis. But before you give the interpretation, you have to do the multi-weight analysis or you need to do the standardization process. This is a very interesting the simile is that when we consider the USA crude death rate, for example, it is 9, suppose, and India crude death rate is 8, then whose death rate is more? Just write in chat box. I say the crude death rate in USA is 9, crude death rate in India is 7. Which death rate is more? Just write down in the chat box. USA CDR 9 and India CDR 7. Which one is more? Tell me. Which death rate is more? Anyone else? Yes, Sudhir Kumar is right. We can comment after standardized mortality ratio, right? Or standardized mortality rate. Because we don't know about the population. Population comes, the old age people in the USA may be more, and that's why they may be dying. And in India, there may be a small children may be dying more, right? And but relative population of old age is less. That's why we might have CDR. So we can't compare CDR to CDR. We need to compare population wise, and then we can find out the standardized mortality rate. And that is very interesting. And UG student must be explained that. On one side there is elephant, on one side there is a only small ant, and then if you start comparing, there is no comparison this, right? So even if you want to compare the food intake, you should take a weight of both and that food of both, and then so try to take a ratio how much food they are eating, like that. Any other question? Next time I before we take a next lecture, you should try to define the, or you should try to go through this website, Problem Solving for Better Health. And that website, I think, uh, PSBH, um, I think I will share that link because you may not be able to find out the exact website. Any question? Nidhi Ben is going okay? Anyway, we next once this meeting is over, I will find out and then we'll tell you. Can we copy data from AP Info to Excel? Yes, it is is possible. Store data, yeah, it is AP Info from you can export the data from AP Info and you can import the data from Excel. You can export. Excel is possible. If you want to see it, I think I have a possibility of sharing the screen and then I can show you the 15.4 and there's something like export over here. You can see the export and then you can replace or append, and once you use this export command, you will be able to whatever you want to find out, whatever data you want to do the export, that you can do. Hmm. Output format you can find out Excel. And then now this has gone to a particular Excel file. So with this export command, you can do this. And you can write a specific variables also. Merge, you will be able to merge two files together. This is the basic is very easy. But if you want to go for advanced, then you need to go for the statistical analysis. See, as far as the research topic is concerned, it's not that you should take it seriously. You should answer these few questions and then take it a serious question in mind. And if you cannot collect more than 10 data, it's okay. We will be helping to collect more data. So first you should be asking yourself your area of interest. You list out your area of interest. Then uh, in relation to this, what are the problems around you? Around you, where do you stay or where you are connected? Yes. And then, is there any solution to that problem? If there is no solution, don't take that problem. You should be able to solve that problem at least to a little bit. For example, people are taking cold drinks, and your area of is your nutrition, and you think that you can convince few people out of 10 or after 20, at least one people, how to replace the cold drinks with a healthy drinks. Then you can take the topics, right? So without intervention, only finding out the problem, I think as a youngster, you should avoid that. You should be able to bring the some changes. For example, what right recently, uh, my wife Hema Ben, she is doing PhD in lifestyle change by understanding of spirituality. I will be floating this paper, the variables and form to you also. You can participate that. If you want to motivate people to do go for the meditation, what are the points you should be talking to the people? How you can convince them? That's the thing which you can take as a challenge. But if it's very difficult, then you may avoid that. For the learning purpose, you should take a simple topic whereby at least you can collect 10 observation. Other 10 people will be able to give you 10 observation. So 100 observation for the purpose of analysis, and you'll be able to do some good analysis on that. For example, in this case, if you want to do the uh, correlation, linear regression between the outcome variable is a temperature. Uh, temperature, where is that? Water intake, income, gender, histo, core body temperature is the outcome variable, and then other variable is TLC. This regression analysis will get between the two, and whether there is a the correlation or not, that we can find out. But the correlation you can say is a zero almost. It's not They are not correlated. If it is near to the one, it is correlated like this. So between two countries variable, you can use this regression analysis also. But because of small data, you will not enjoy that, right? Or you can go for the mean of the core temperature of the body versus gender. Between is there an effect or not? You can see that a very small difference, 102.670, right? Anyway, so uh, we'll end up over here. Uh, Go on asking the questions, right? And sometime I will be the series of the lectures will be like this only, but for evening session will be kept for rest of the students who would like to interact.